Hello, everyone. Welcome to another edition of Fit RX. I am your host, Dr. Greg Dennis. We have a very interesting topic today. My guest today is Dr. Navaz Habib. He is a doctor of chiropractic and a functional medicine practitioner who is going to be talking to us about the vagus nerve. So, Dr. Habib, welcome to the show.
Thanks so much for having me, Greg.
Okay, so first, just tell the listeners a little bit about you. Just kind of what you do.
Absolutely. I am a chiropractor by profession and a functional medicine practitioner, as you mentioned. And what that means essentially is I approach health from the root cause perspective. I approach health from the idea of helping people figure out what challenges are causing their health struggles to begin with on an individual basis, not on a diagnostic perspective, not on a perspective of you have this, so I'm going to give you that. What we're looking for is, why does X individual, this person that I'm looking at in my office or currently on a Zoom call, who is this person? What have they experienced in their life? What are the challenges, the stressors, the things that have occurred in their life that cause them to go down this path and deal with the health struggle that they are currently dealing with? And what that led me to do is to go into functional medicine and to help figure out what it started with me figuring out what was going on in my own health and my own struggles, and to become the version of myself that I am now.
Perfect. So, and I read a little bit about, your story. So elaborate on that a little bit. So when you went to chiropractic school, were you just planning on practicing traditional chiropractic medicine? Or, at what point did you discover functional medicine and that you wanted to kind of practice this style of medicine?
Yeah, it's a great question. So yeah, initially I always knew I wanted to be in healthcare of some sort. I always had this lean towards being a doctor of some sort, and chiropractic helped me quite a bit when I was a teenager. I had a lot of back pain, growing pains is what they were calling it. And lucky enough, my mom's really good friend was a chiropractor. And so I would go and see him every week, figure out what was going on. He would give me a couple adjustments, some exercises, some tools to help overcome these challenges. And pretty quickly, those challenges ended up going away. So for me, it was very much chiropractic was something that helped me, and it was something that I wanted to help others with. It was a tool I wanted to use. And so, yeah, that was initially the intention of going to chiropractic college. When I was at chiropractic college, I was not in the best of health. I weighed 250 pounds, high blood pressure, high blood sugar, borderline diabetes. I was being prescribed medications. I was doing my best to not have to take those. I really wanted to figure out why I was experiencing these challenges. What was it from the stressors and the challenges from a biochemical perspective that I was experiencing that led me down this path? And once I finished chiropractic college, I stepped out. I practiced as a chiropractor hands-on, but my health just continued to deteriorate. And so I got to a point where I said, I need to do something about this. And lucky enough, I had my wife there partnering with me, and we were doing these things together. And we started looking at weight loss and looking at the journey of what was going on with little success. And that's when I was lucky enough to meet my mentor and really good friend, Sachin Patel, who introduced me to functional medicine and to look at health from the perspective of creating optimal function within the body, not necessarily from a disease and a sick-based perspective, as unfortunately a lot of the conventional system kind of looks at it. We wanted to look at it from what can I do to become better rather than to stop the bad from being there. And that's when I started changing my diet in a very positive way, eliminating stress in a very positive way. And I ended up losing 75 pounds, got rid of all of those health struggles that I was talking about. The blood pressure came down to optimal. Blood sugar came down into an optimal zone. But the thing that I noticed more than anything else was my energy levels. I never really understood what was going on and how little energy I truly had. But I would start to wake up then, after having come to this new healthy state, I would wake up in the morning super energized. I would jump out of bed. I was ready to go. I felt spectacular. And because of that, it was my driving force to say, I need to get into functional medicine. I need to share this tool with so many more people, because I think the effect that it's going to have is so much more positive, so much more long lasting, and will help so many more people.
That's great. Yeah. If anybody listens to my podcast, they know I'm not really a fan of conventional medicine. As you alluded to, it doesn't really treat the root cause as something like functional medicine does.
Yeah.
So you got trained in functional medicine, began practicing this way. And so at what point did you focus in on the vagus nerve? I mean, so, the vagus nerve is a pair of nerves. There's all kinds of anatomical things in the body that you could have focused on. So what brought your attention to the vagus nerve that, then to where you progressed to write a book about it and all that stuff?
Yeah, great question. I think my initial kind of experience with the vagus nerve came through chiropractic college. I was very, very interested in anatomy, in why things were connected the way that they were, and how the messages were sent from one area of our body to the others, and the connection that was built up. And the vagus nerve always stuck out to me, being the only cranial nerve that ever leaves the cranial cavity and goes to other places. But it doesn't just go to other places, it goes literally everywhere within the thorax and abdomen. Almost every single organ in our entire body has some connection to the vagus nerve. I was really intrigued by that. Never really understood why, but it really sparked this idea of like, let's figure out what this is doing. And once I got into functional medicine and started working with people, I started noticing that there was a very common set of challenges that tended to occur despite the diagnosis that was given. Whether there was some level of inflammation or autoimmunity that was occurring, we were looking at a challenge with the inability to control either something going on in the gut or something going on from an inflammatory perspective throughout the rest of the body. And the connection point really showed up when I was doing some work one day, and I said, this organ is connected to that organ through the vagus nerve. And there was this really quick kind of thing like, oh, I should really look into this a little bit more. And so I started doing a little bit of research. I ended up writing a blog post on the topic on how to upgrade your vagus nerve and some exercises you can do. The funny thing was, I never had the intention of writing a book on the topic, but because of that blog post, had somebody reach out to me from a publisher's office a couple of years ago. And they said, we loved the blog post that you wrote. Would you be interested in digging into this more and actually writing a book on the topic? And I said, yeah, absolutely. No question about it. And so that's where the real heavy lifting and hard work showed up for doing the research into the vagus nerve. And that's where I was able to learn a lot more.
Interesting. Okay. So as you begin researching this, so let's just kind of start with the basics for the listeners. So just kind of define what is the vagus nerve and what does it do in the body?
So the vagus nerve, and this is a bit of a misnomer, it's not a vagus nerve, it's the vagus nerves. There's two of them, one on each side of the body, and they are the 10th cranial nerve. We have 12 pairs of cranial nerves that come out of the brainstem and that go to different areas of our head primarily and affect different things like lacrimation, things like our taste buds, things like our sight and our smell are all controlled and signaled through cranial nerves. But the cranial nerve 10, which is the vagus nerve, is the only with the stomach, small intestine, large intestine, gallbladder, kidneys, spleen, pancreas, essentially you name it, every single organ in our body is directly connected to the vagus nerve and sends signals to and from the vagus nerve. And there's some other muscles and other areas that are connected as well, which come into play when we talk about how to optimize the function of the vagus nerve. Things that I started learning when I was doing work with patients, when I initially did some research into the vagus nerve and started implementing with them with great success. So that was a really cool kind of thing that I was able to learn. And those were that the vagus nerve is connected to a part of skin in the ear and to the muscles of the larynx and the pharynx. the muscles in the throat, the back of the throat, the back of the airways. And this was really, really important as it came down to how to affect the vagus nerve positively. We can talk a little bit about that in a moment.
Okay. All right. So let's talk about what happens when the vagus nerve isn't working right. So someone has a vagus nerve dysfunction. So, what are going to be some signs, symptoms? How do we know? How do we diagnose that?
It's a great question. And the vast majority of what the vagus nerve does is it's signaling information from the organs to the brain. This is really important to remember when we're thinking about what it's actually doing and what information is being passed through the vagus nerve. And so about 80% of the information on vagus is actually afferent information from the other organs, from the heart, lungs, kidneys, stomach, intestines, etc., all the way up to the brain. And a big part of functional medicine is talking about gut health and understanding that the microbiome plays a major role, the balance of the microbiome, neurotransmitter balance, what's going on in the gut. And that's really important. But how does that information then play a role in how our brain then functions, or what we're then experiencing in our daily lives? And that is, the gut connects via the vagus nerve to the brain. That information from what's going on in the microbiome, any imbalances that might be occurring, goes up to the brain. One of the most common things that I see is some sort of dysbiotic microbiome, some sort of challenge from a bacterial imbalance or a parasitic infection or a yeast-based or worm-based overgrowth that might be triggering some sort of digestive dysfunction that cannot be controlled with the anti-inflammatory effect that the vagus nerve is also having. So about 15% of the information on the vagus nerve is parasympathetic, and it's going from the brain to all of those organs. The parasympathetic nervous system is our rest, digest, recovery side of the autonomic nervous system. The autonomic nervous system essentially is the unconscious functioning of what's going on in the rest of our body and the unconscious control of what state our body is currently in. So let's think about, for example, when we're under stress, our boss comes by, taps us on the shoulder and says, "Hey, I need to see you in my office right now." Immediately we go into a stressed state. That's actually called the sympathetic state. We go into a state called fight or flight. What we've done is we've shut off the vagus nerve or decreased the function of the vagus nerve during that time. And we go into this fight, flight, reactivity based state where we're on alert for what might be going on, something that might be negative or something that might be stressing us out. And what happens is we have different reactions that occur. Our eyes dilate, our hands become sweaty, our blood flow actually shifts from going from the organs to the muscles of our arms and our legs. So we can either fight off a threat or run away from that threat as well. So fight or flight. And so it shuts off the internal organ functioning or shuts it down to a very minimal amount. And that tends to happen when we're under a state of stress. What the parasympathetic nervous system is, where the opposite side of this, which is controlled through the vagus nerve, is the rest, digest, recovery side, where we should be spending the vast majority of our time is in that state. And when we're in that state, it's when we're nice and calm. We've just watched a funny movie, we're chilling out with friends, we're laughing with our partner. The idea of being able to be in a calm, relaxed zone. And what happens in those states is our blood flow shifts back towards those organs at our midline. We tend to be a lot more happier, a lot more relaxed. And those are, that's a sign that we're able to control the stress that might be coming up and recover from it on a daily basis. When we know that the vagus nerve is not working well is when we are under chronic states of stress. When we're in that sympathetic zone way too much, when we're in that fight or flight zone way too much. And I talk about stress, but I think it's important to note that there's different types of stress that can trigger that reaction that push us from parasympathetic to sympathetic. There's the ones that we generally think of when we think of stress is emotional stress. What's going on from an emotional perspective? What's going on from work, from finances, from relationship? There might be some challenges going on there. Psychological stress, things that might have happened in the past, memories, negative trauma, stuff that might have been held on to for many years, that can have a very specific effect on our state. There's also physical stress, which is things like postural, lack of exercise, poor muscle function, joint pain, stuff like that. Those are physical stressors. And then we've got the biochemical stressors, which are things that we can't exactly see unless we test for them and figure out what's going on there. And those things tend to increase inflammation within the body. Those things increase the inflammatory processes that come up because of dysbiotic bacteria, a microbiome that's imbalanced, parasites that might be stealing nutrients away, things that are creating a leaky gut in the digestive system specifically. And so those stressors all shift our state into more of a sympathetic fight or flight state because our body is on alert trying to stop us from experiencing those stressors. What we need to do is to be able to shift back into that vagus nerve parasympathetic state. And for a lot of people, that can't happen. So when we're under those four different types of stress, that's when the vagus nerve is vulnerable and unable to do the job that it needs to do. And that's when we start to see diagnoses of autoimmunity, inflammatory conditions, challenges that people hadn't really thought of, and low energy and gut dysfunction tend to be very, very common with vagus nerve dysfunction.
So you can't really measure the vagus nerve function per se, can you? It's just all these other things that are going on, and then you can deduce, okay, because of stress in the body, whether that be emotional stress, physical stress, you likely have, a vagus nerve dysfunction. Is that accurate? Or
so I think there's some accuracy in that, but more recently, we've actually come to learn a little bit about heart rate variability. And heart rate variability is the best way to measure whether our vagus nerve is working well or not. Heart rate variability is different from heart rate. Our heart rate, we all know how many beats per minute. But the number of beats per minute give us a little bit of an indication of what state we're in, whether we're in sympathetic or parasympathetic, but it doesn't tell us how resilient our body is to stress. That's what heart rate variability tells us. So heart rate variability is a measure of the number of milliseconds between beats of our heart. So let's say, for example, we've got two people at 60 beats per minute is their normal heart rate. But person one has a heartbeat that is occurring almost like a metronome, that there's a very little variation between the milliseconds or the time between beats of their heart, okay? And that means that their millisecond numbers are a little bit low. And so the average variation between the beats per minute for that person can be something around 20 to 30 milliseconds is the variation that occurs, the average variation. That's what heart rate variability is measured as. Where the other person, the second person, still at 60 beats per minute, but they're not beating like a metronome. It's not every single rhythmic beat. It's actually happening where a couple beats are a little closer together and a couple beats are a little bit further apart. And because of that, the variation is significantly greater. The average number of milliseconds between beats of the heart is longer. And so this person is at the 80, 90, 100 milliseconds between beats on average. This is a direct sign that vagus nerve is working better because they're able to create a resiliency regardless of whatever stressor is about to come up. There's resilience that the vagus nerve is able to send a specific signal to the heart to slow the heartbeat down even when it becomes faster. So heart rate variability is actually an indirect measure of, but a very, very accurate measure of vagus nerve function. And that's a great tool that anybody can use to determine what their vagus nerve is actually doing and how strong it currently is.
Yeah, I actually interviewed somebody from Whoop. You're probably familiar with the Whoop strap. I have one on right now. And so if someone wants to learn a little bit more about that, you look back at my episode on Whoop, and we talk a lot about heart rate variability. And so short of that, though, if somebody doesn't have some type of a wearable, say they come to see you, I mean, how are you going to know, if they have a vagus nerve problem?
Generally, it comes down to the symptoms that they're experiencing, the inflammation level within their body. One of the more common things that I see is some sort of inflammatory function that's occurring. And part of what the parasympathetic innervation to these organs does is it helps to control inflammation. So the neurotransmitter that the vagus nerve uses is called acetylcholine. It's the same neurotransmitter that's primarily used from our nerves to our muscles to signal to our muscles to actually perform an action. But the vagus nerve sends acetylcholine to the organs of our digestive tract and to the internal organs in our heart and our lungs as well. And so when inflammation levels start to come up, and these are markers like calprotectin, these are markers like CRP on blood work, these markers, when they start to creep upwards, it's a sign that vagus nerve is not able to send in the acetylcholine at a high level to bring down the inflammation. And this system is actually called the cholinergic anti-inflammatory system. That's something that's mediated primarily through the vagus nerve. And so if somebody doesn't have a wearable, somebody doesn't have a tool to be able to tell me what their heart rate variability is, I'm looking more towards symptoms. I'm looking more towards those challenges. And another really interesting tool, something that I do, is I listen to their voice and what they're not what they're saying necessarily. I obviously will listen to the words that they're using, but I want to listen to the tonality and the pitch in their voice. The ability to raise or lower pitch is really important in the vagus nerve. The ability to go down to a really low voice or to really, really high voice is really, really important when it comes down to this. And that's because, like I was talking about earlier, some of the muscles around the larynx are innervated by vagus nerve. And so these are the muscles that actually pull and stretch and tighten the vocal cords. And so the ability for pitch and tonality to be present within our voice is actually a sign of vagus nerve function. So somebody who's very monotone, very stuck in a simple tone and unable to raise or lower their pitch very easily is generally somebody who has vagus nerve dysfunction as well. And that's something that we need to look at when we're assessing somebody.
Interesting. Okay. Yeah, it seems, well, there's a lot of overlap in, when I look at a patient and overall health. And if they're stressed, whether that be they're not eating right, they're obese, they have diabetes, pre-diabetes, so they have physical stress, they have emotional stress. I mean, we're going to see signs, not only physically, we're going to see signs on lab. So even if they don't have a wearable, I mean, you're saying you're going to be able to tell that not only they have all these other things, but that's also translating over into some vagus nerve dysfunction.
Yeah.
Is that correct?
Yeah.
Okay. All right. Very good. Okay. So I guess probably the question everybody wants to know, how do we improve this? How do I fix my vagus nerve dysfunction and or improve it? And this is, for me personally, something that drives me crazy because I have a wearable, I have a Whoop strap, and my heart rate variability is not that good. And feel like I'm a pretty darn healthy guy. Like I work out all the time. I'm low body fat. I intermittent fast. I eat healthy. I sauna. I do cold thermogenesis. And my heart rate variability just is not. So it's not that good. So it's frustrating. But anyway, so tell us how can we not only improve heart rate variability, but just improve our vagus nerve function in general.
For sure. It all comes down to a couple of different practices and tools that we can use. But the focus of all of the tools, all of the different things comes down to our breath and our breathing patterns. It's really, really important that we know how we are breathing and the effect that our diaphragm has on functionality within our entire body. So I mentioned earlier and just quickly kind of alluded to it, but the vagus nerve courses through the diaphragm and alongside all of the other organs that course through the diaphragm. But it doesn't directly control, the vagus nerve doesn't directly control the diaphragm itself from a functionality perspective, but the diaphragm itself has a very direct effect on how strong vagus nerve is functioning. You'll notice that your heart rate generally, when you breathe through your nose, your heart rate generally is going to come down. The slower breaths where we do this kind of 4-7-8 breathing, we'll talk about that in a second, can have a very positive effect on lowering heart rate and increasing heart rate variability. And that's a direct then sign of vagus nerve function. So breath really is kind of the key to all of this. We want to make sure that we are breathing correctly. And if you ever watch a baby breathe, a new baby that's like a newborn, you'll often see they tend to breathe mouth closed. Okay, so lips are generally closed or not open, and they're breathing through their nose, which is the first thing. And the second thing is they're breathing using their diaphragm. You're noticing that belly is rising and lowering. And yeah, it's going to be a little bit quicker than an adult. Generally, they tend to have a higher breath rate and heart rate right off the bat, just being new to the planet. But they have this diaphragmatic breath where the belly is rising and falling. And what that's creating is a pressure in the abdominal organs. It's almost like a massaging pressure to those organs. It calms everything down and allows it to function. Too many of us, as we grow older, as we get into our teen years, as we get into our 20s and 30s, we forget how to breathe correctly. You often have somebody ask you to take a deep breath in. You'll notice take this deep breath in and it's all in your shoulders and upper back and traps. And too many of us are learning that we're breathing using our shoulders and our traps. And those are actually accessory breathing muscles. We're not fully breathing in because we're not fully using our diaphragm. And when we're not fully breathing in, we're actually creating a physical stress in our body. We're actually putting ourselves into that sympathetic zone because we're not using the diaphragm the way that we should be. So it all really comes down to breath. But how do we then add on to it? So the same way when we go to the gym, we want to, let's just say, for example, we want to increase our bicep curls. We want to get really, really strong on our biceps. The first time we go to the gym, we're going to start with 5s or 10s on 5 or 10 pound dumbbells and do basic weight training and get to learn that motion pattern. You're not going to go and pick up a 50-pound weight right off the bat because you haven't trained your body to do so. The same way we haven't trained our body to breathe really effectively if we've forgotten how to do it for a long time. So it takes time to rebuild this. And so a consistent practice is necessary. So let's go from that 5 pound now where we've learned we're focusing on our diaphragm. How do we get that understanding that we should be breathing through our diaphragm? One of the practices I get my patients to do is have them have a seat in a comfortable position, kind of off their chair back a little bit, and put one hand on their chest and one hand on their belly. And when they take that breath in, notice which hand is moving. Is it the hand that's on the chest, the top hand that's moving in and out, or is it the hand that's on the belly that's moving in and out? And this is a simple tool that anybody can take on and use right off the bat. And you'll notice that when we're under stress, we generally are going to be breathing using our upper chest, and our upper hand is the one that's going to be moving. And learning to create the awareness and shift the breath towards that diaphragmatic belly breathing, where we create almost a balloon effect within our belly where it expands and contracts with each diaphragmatic breath. That's going to be that initial, let's train this motion pattern again. We want to take it to the next level. Let's get up to the 10s and the 20-pound dumbbells. The way to do this is to start doing that same diaphragmatic rest, digest breath, but under some sort of stress. Okay. And so when you're doing, you talked about cryotherapy, getting into like a cold shower or getting outside into freezing cold weather where possible. These are great tools for vagus nerve function if we're using them correctly. And when I say if we're using them correctly, I talk about cold showers with my patients quite a bit. I like to have people start with 30 seconds and build yourself up to a full shower that's in extreme cold or as cold as you can handle. Obviously, quick disclaimer, if you're dealing with like a Raynaud's phenomenon or something with the temperature regulation issue, you're not going to want to do this. Obviously, it's not safe, but we want to make sure that those who can do it take this on. And so what's the first thing that happens when you jump into a really cold pool or a cold lake? Your body contracts and you immediately go into this physical stressed state and you start to breathe again very shallow and through those traps. And so what I like to have people do is train themselves under 30 seconds or a minute of cold water to get that breath back to their diaphragm. Get that breath focused on, yes, there's a stressor, but I'm going to relax and go into a deep, calm zone while the stressor is present. And so you're training yourself to breathe correctly under stress, same way that you would be as you get up to that 10, 15, 20 pounder. on training your biceps. As we want to go higher, you lengthen the time of that shower. You can add in other stressors as well. So things like yoga or Pilates are wonderful tools, because the focus of yoga and Pilates is breath and breathing effectively under stress. And let's take yoga, for example. You're going to put yourself into different positions, physical, stressful positions, while still focusing on your breath. And if you can't breathe in a specific position, then you're going to break that position. Unfortunately, you're going to not be able to hold it for the entirety of the time that you're hoping to. Training yourself to do that, again, is another stressor. So we're getting up to that 25, 30-pound dumbbell with some sort of yoga or something along those lines. If we want to get to the absolute top of our absolute peak in vagus nerve function, it comes down to, again, breath under extreme stress. So think of guys like Tiger Woods, the highest performers out there, people like Beyonce, Mariah Carey, like the best performers that you have under stress. The Kobe Bryant during his time, they were able to perform under extreme stress, but at a very high level. They were able to make sure that the stressors that were around them didn't affect them at their root, and they were able to perform under pressure. They trained themselves so well in training and in practice to be able to function at that really, really high level. And so these are the tools that we need to be able to start to use. And it comes down to consistently learning how to bring our state back to parasympathetic, regardless of the amount of stress that we're experiencing.
So I've read a little bit about what you just said, but I'm like a lot of people, you get busy during the day. I get busy seeing patients. And so I'm not focused on breathing when I'm just busy trying to get through the day. So how do we get into that habit of breathing that way, all the time, without thinking about it?
Totally. And creating that habit is one of the most difficult things. As we know, creating new habits is always tough. What I like to do is in my regular day, I'm seeing 6, 7, 8 patients a day, and generally quite busy. What I like to do is every hour, I like to make sure that I take a moment and just kind of relax and go into a calmer state. And there are some other innervations or other connections that the vagus nerve has that can help us shift that state really quickly. So we talked a little bit about the laryngeal and the pharyngeal muscles that are innervated by the vagus nerve. And those are required for keeping the airway patent, but also allowing our voice box and our voice to function, and with that pitch and tonality that we spoke about earlier. One of the best things we can do is to actually activate those muscles for a couple of minutes every hour. And that'll help to create a level of consistency and a level of strength within our breath, regardless of how busy we are. We can take a minute to 2 minutes every hour to be able to do this. So the 3 exercises that I have people do are humming, chanting, and gargling. Okay. You can also sing as well. So if we're not in lockdown, like I unfortunately am right now due to the world situation, I used to drive to and from work, just like a lot of other people. And what I would do is I would sing in the car. And you didn't realize, but when we're singing in the car, we're actually in a very calm zone. We're in a very happy state, and we're activating our vagus nerve as we're doing that. So it's a calm plus innervation to the muscles around the larynx and the pharynx, allowing that to occur. Humming does the same thing, and we can just do a minute of humming prior to eating a meal. So right before we sit down to have our lunch, ideally in a calm, relaxed zone, we're not eating in a big rush. Take a moment and do a little bit of humming and calm yourself down. It's a tool that my 3-year-old daughter loves as well. And we just do this. And I've learned to kind of help train her so that this doesn't become an issue for her in the future. But learning how to get into that parasympathetic zone right before right before using your digestive system is really important, because that turns on the vagus nerve for digestion as well. So singing, humming, and then what I like to do as well, to kind of bookend the day when I'm brushing my teeth, I have my patients do this as well, is add gargling to the mix. Gargling is a really, really strong tool. It's something my dad has been doing for many, many years. I talk about it in the book. I used to laugh at him, and now I realize what he was doing was really keeping himself super healthy by doing this. So I have my patients keep a cup right beside their sink. And what you're going to do is take some warm water, add a little bit of salt to that warm water. It helps to break up some of the plaque at the back of the throat as well. And when you brush your teeth in the morning and the evening, what you're going to do is fill up your cup with some warm water, throw a little bit of salt in there, and you're going to gargle. And you're going to try to do it for as long as you can, as hard as you can, multiple times at the beginning and at the end. It just adds on about 1 minute to 2 minutes to your routine at the beginning and the end of the day. And what it does is it essentially, what gargling is we take this water in, but we're trying not to aspirate. We're trying not to inhale it, and we're trying to not let it go down into our gut as well. So it allows us to use our pharyngeal muscles while using our laryngeal muscles to create the sound of the gargling, the grrr sound that will come from it. And so we take these 3 sips and we do it for 15, 20, 30 seconds, whatever we can muster. And it'll help to stimulate those muscles at a very high level. When we stimulate those muscles really effectively, that's telling the vagus nerve to activate, activate, activate. And it'll help to shift that parasympathetic state on, the sympathetic state off. And again, then focus on not just breathing, but airways. And we know that when we're stimulating the vagus nerve with muscular function right there, we're actually stimulating the area of the brainstem to stimulate the actual nuclei that are involved in vagus nerve function to turn on. We know that's working when we do that gargling exercise and we start to actually tear from our eyes. That's a direct sign that we've stimulated the brainstem and those nuclei enough, because an adjacent nuclei that's involved in lacrimation and tearing has actually been turned on. So we want to be gargling pretty hard, as hard as we can, until we actually start tearing from our eye. That's a direct sign that you're doing a great job with that.
Okay. I want to go back to the breathing for just a minute.
Totally.
I have 2 questions. One, do you feel like that the breathing is going to move the needle the most as far as like increasing heart rate variability? And then my second question, what about nighttime? You know, a lot of people kind of are mouth breathers at night. I've tried in the past using duct tape, to tape my mouth. Do you have any suggestions as far as that and being able to become a nasal breather at nighttime?
I think breath is one of the biggest needle movers that doesn't involve using other tools. There are some really interesting tools that are coming out more recently. Things like the Gamma Core tool that you can put right on the neck to stimulate with like an electrical stimulation on the vagus nerve. Magnets, acupuncture is actually a really great tool for vagus nerve activation as well, specifically auricular acupuncture, parts of the ear that are directly innervated. Stomach 36 is another great point. There's a few different acupuncture points. Where we're not getting therapy from outside, I think breath truly is that major tool that we will get the greatest movement on that needle from.
Okay.
And then when it comes down to sleep, and sleep really is where the vagus nerve does its real work. It's like the gym where it gets to work out. Where we tend to be mouth breathers, it can be very, very difficult. There's a really great book that just came out with James Nestor, Breath, and he talks a lot about the effect of mouth breathing and how negative it can actually be to our overall health. I myself am guilty of this myself. So you talked about duct taping. I actually tape my mouth shut. I do mouth tape at night, and it has been an absolute game changer. It's shifted on nights when I don't do my mouth taping versus nights when I do my mouth taping, my heart rate variability can be between 10 and 15 points difference. And tends to be obviously lower when I mouth breathe. So I do mouth tape as well, but something that helps me to make sure that I'm breathing through my nose and not feeling the anxiety of not getting enough air in is I actually use Breathe Right nasal strips on my nose as well to open up the nasal passages. So that's a really, really simple tool that anybody can kind of add in that can be really, really beneficial in making sure that the nose breathing is occurring, that the air is getting filtered through the nasal hairs, and activating the sinuses as well to humidify that air, to make sure that the immune system is reacting against anything that might be getting in, because we don't have that filter when we're breathing through our mouth, and that allows things that shouldn't get in to get into our lungs.
Okay. Are you familiar with any other devices? I've looked like on Amazon. I found one little mouthpiece that you sleep in. It didn't have all that great reviews. I mean, if somebody doesn't want to duct tape their mouth shut. Are you familiar with any other kind of mouthpieces that can help with that?
It's a really great question. I am not familiar with any specifically. I do know anything that helps us to put our tongue onto the palate, on the roof of our mouth, is actually going to decrease our ability to breathe through our mouth as well. And it shifts us to breathing through our nose. So anything that can help us get into that, that area, it's kind of difficult to say because there's so much different individuality and specific individual recommendations there.
Gotcha. And I want to get into some other stuff that can maybe help too, but how specifically on heart rate variability, how much can one expect to improve? I know that naturally declines as we age. I'm in my 40s. My heart rate variability tends to hover kind of around the 40s. If I got my breathing corrected or improved, how much increase could I see in heart rate variability at my age?
Something that I've seen with working with patients is generally when we focus a little bit of that time and create a level of consistency with the breath, with certain exercises and other tools, and allowing ourselves time to recover as well. Really, really important that we take some time off to allow recovery to occur, because we know exercise is a stressor as well. So taking some time off, especially on days when your HRV is a little bit lower, not pushing yourself too hard. I imagine that's something that you talked about on the Whoop Bend session as well. But recovery is key. I've noticed that we can create an average elevation anywhere between 10 and 15 milliseconds between about 6 months to a year of work. And that's not a small number for somebody that's in the 20 to 30, 40 range. It's not a bad number to be able to shift into the 50s and 60s. And those are generally, you're looking at basic, not bad health when you're in your 50s and 60s. Those are pretty good numbers. Anything above 60, we tend to be getting into really, really super healthy. And then some of the best, like elite athletes, you're generally looking around 90, 95, 100, even into the 120s where it can occur.
Okay. So somebody like myself, I'm probably, if I hover in the 40s, I'm probably not going to be able to get to the 90s.
We could probably get you up into the 50s, 60s pretty simply. I haven't worked with people significantly long enough to say that we can get up to the 80s and 90s, but it is possible. It really does say something about if you've trained to be super healthy and fit from your childhood onwards, that you can actually create a very positive response there as well.
Okay. And before we get into some other stuff, so if somebody is listening to this and they're doing things, breath work and other things to improve their vagus nerve, but they're still doing a lot of other unhealthy things, like they haven't got they're overweight, they're eating terrible. Can they still get improvement of their vagus nerve, or how do those two kind of overlap?
They can, but they're kind of stepping on their own foot with those other challenges. It really does come down to trying to do everything as holistically as you possibly can, right? Getting rid of that excess weight, decreasing the inflammation markers. We know that weight is associated with CRP levels, and with higher CRP now, it's actually been proven there's a direct risk with COVID infection and the severity of COVID with CRP levels as well. So anything that can increase inflammation, we want to try to decrease that, the exposure to those things. And we're naturally going to have some level of exposure to certain stressors, environmental toxins. We all kind of drive cars, stuff that generally is around. We're going to have some exposure. So things that we know that we can avoid, we should probably do our best to avoid. And those can be things like making sure that you're eating a relatively healthy diet, that you're getting the right micronutrients into your diet, because those micronutrients are going to allow the cells in your body to function at a high level where otherwise they wouldn't. They're actually very important in helping to create that balanced microbiome as well. And that'll help decrease inflammation levels within the body. Anything that increases inflammation, we want to try to cut out. Anything that tends to bring inflammation levels down, whole food diet, eating clean, eating healthy, good fats, all of those things, that's what we want to be focusing all of our attention on. And so just doing the breath work and just doing the vagus nerve exercises without doing the diet and other necessary tools, you're really stepping on your foot, and there's no chance you're going to be able to elevate significantly.
Yeah, gotcha. Makes sense. So, okay. Other things that can maybe improve our vagus nerve. So you talked about breathing. You talked about like humming, the chanting, singing, that kind of thing. We briefly talked about cold thermogenesis, and I've got a whole episode on that in my podcast early on if people want to listen to that. So, anything else? Are there other things that we didn't talk about?
There's a few more. I talk a lot more about more in the book specifically, but things like acupuncture I talked a little bit about is wonderful. Massage therapy, visceral manipulation. These are great tools to have somebody else do with you. Listening to music is really, really interesting. And I actually get into this a little bit more in the book, but there are certain types of music that tend to be more calming. Classical, instrumental type music is really good. There was actually a really great study that pointed out that there was a specific piece by Mozart that was shown to elevate heart rate variability levels more than any other piece, and that was K448, Two Pianos by Mozart. It's on YouTube. It's something that I listened to for fun while I was writing the book as well. I did notice that I got into a flow state pretty easily with that. So K448, Two Pianos by Mozart, highly recommend. And then another really important one is sleeping on your side, the position that you're sleeping in. When we sleep on our back, we tend to be more likely to have kind of the jaw falling back and closing the airway. When we sleep on our stomach, we tend to be really jarring our neck or rotating excessively and creating physical stress throughout the entire night. So sleeping on your side has actually been proven to increase heart rate variability. There's very little variation from side to side, but shifting from side to side is probably the best tool if you do need to move in the middle of the night as well.
Okay. Well, very good. Anything else specifically about the vagus nerve that I didn't ask that you think is important?
No, I think we covered pretty much everything.
Okay. All right. Well, very good. So I always end by asking my guest to give us one health tip that can make us healthier today. What would you say to that?
Yeah, I think it'll have to step back to the breath again and focusing your attention on breathing. Making sure to take a moment, even like in this moment, taking a second, putting a hand on the chest, putting a hand on the belly, just letting yourself close your eyes and let that breath go back to diaphragmatic breathing. It's amazing what just 2 or 3 breaths can do to your state and to shift your overall health and create positive digestion, positive microbiome, positive intention within the body. It's nothing has matched the breath in what I've been able to help people accomplish.
Very good. Okay. So the book is called Activate Your Vagus Nerve. How can people get a hold of you?
You can find me on Instagram, Dr. Navaz Habib. And you can go to healthupgraded.com to learn more about me and our programs and how we help people achieve optimal health.
Perfect. Okay. Well, Dr. Habib, we appreciate your time and expertise on this subject, and I appreciate everyone listening, and we will talk to you next time.
Thanks so much.
Okay. Well, very good. Well, thank you very much. I'm glad I caught you
pleasure.
before you had your baby.
Yes.